very much for joining our webinar today, which is part of Smart Sustainable City Member Focus Group. Today, we're actually doing this webinar in association in partnership with APEKSI, the Association of local governments in Indonesia. And we're very thankful for our sponsor, just like Marten, Basil, G4S, and Jakarta Land. And so I also would like to share that, like at the end of this the sharing session, I will summarize in Indonesian for the attendees here today before we go into the Q&A and sharing session after the presentation by our panelists. Okay, to start, we will have an opening remarks by the chair of BritCham, Mr. Olly, and also by Vice Chairman of APEKSI, Marten Taha, who is also the mayor of Gorontalo City. So I pass over to you, Olly, and Marten.
Thank you, Ellen, and selamat sore, ibu-ibu dan bapak-bapak. Firstly, I'm delighted that this webinar represents the start of our collaboration with APEKSI. A big thank you on behalf of the British Chamber Board to Ellen herself as the chair of our Smart Cities Focus Group, and also to the APEKSI team, who I know have invited a number of mayors to give their time as part of this new partnership. We established the Smart Cities Focus Group around 12 months ago now, partly because it had so much synergy with our other key working groups, climate change, human capital and education, professional women's group, the advocacy committee, all of which have themes and actions which are fed into Ellen and her committee on smart cities. And certainly talking to the embassy, the British Embassy, there's a lot of interest in this from the UK, potential investors and businesses around this subject, clearly a very wide-ranging subject as well. For those who aren't aware, the Chamber itself was established 40 years ago to really promote trade and investment between the UK and Indonesia. We have a very diverse board of president directors and country heads, over 240 members, which is growing, and also a recently signed joint trade agreement between the UK and Indonesia governments. So despite this never-ending or seemingly never-ending pandemic, a lot of positive initiatives are ongoing, and with understanding and developing partnerships like this to help facilitate Indonesia's drive, to smart cities is very much a key part of our agenda. On a separate topic, slightly related, we've also very involved with a pandemic relief fund ourselves and CADIN, which has really been driven by the board and the members. This is to help accelerate the vaccine rollout effort across 34 provinces. It's something which we've been looking at in detail and are very keen to be part of, and very important. Other chambers of commerce are involved in this as well as the private sector. So if you are interested, either as an individual or as a business, to really get behind the COVID relief in a sustainable manner and a structured manner, do reach out to us, and I'll happily leave my details in the chat if you wish to have a conversation around that, and I can then introduce you to the right people from our side. So with that, I'll hand back over to Ellen. Thank you to all of our panelists for giving their time, and I'm looking forward to hearing what should be a very interesting conversation. I'll hand back to you, Ellen, and Pat Marten.
Thank you, Olly. Next, Pak Marten, who is the Mayor of Gorontalo and Vice Chairman of APEKSI. I'll pass the webinar to you.
Okay. Assalamualaikum warahmatullahi wabarakatuh. Salam. Om Swastiastu, Namo Buddhaya, Salam Kebajikan. Good afternoon or good morning in UK, and greetings to all us. Dear Mr. Olly, President Director Indonesia and Philippines, Managing Director PEDS, Executive South Asia and India at Michael PEDS, BritCham Indonesia Chairman, and dear Mr. Professor Kevin, Head of the Eijkman-Oxford Clinic Research Unit, and Mr. Arief Tangerang, dear Mr. Basil, Regional Lead for Security Risk Management and Business Resilience of Hill and Associate, Mr. Neville, Director of Enterprise and Innovation of Yorkshire and Humber Academic Health Science Network, dear board and members of BritCham, and mayor of and all city government officers who attending this webinar. Let us praise grateful to the good that gives us the healthy and can attend in this smart sustainable city focus group webinar with the theme cities facing pandemic, adapt or collapse. The cooperation of British Chambers of Commerce and APEKSI. Let us pray from anyone who is still experiencing the pain because of COVID-19. Hopefully they can recover soon and come back in the good health. And hopefully the COVID-19 pandemic will end soon. Amen. I am as the Vice President of Vice Chairman of APEKSI. Let me convey the apology from our Chairman, Pak Bima Arya, Mayor of Bogor, because he cannot attend this webinar since he has another important assessment. Ladies and gentlemen, urban is an area that currently has faced a bound not only because the high population growth, but also followed by the other various problems. Most of the Indonesia cities are facing those problems. In addition with other challenges, such as geographically as a region prone to disaster, including its impacts of climate change, and also there are social political aspects, and now is added by the COVID-19 pandemic situation. As part of the global society undergoing is the sustainable development becomes on
Martin, apologies to interrupt. I believe your microphone is muted. Thank you.
Okay. Thank you. Ms. Ellen? Okay, Ellen.
Yes, Pak Marten.
Okay. The British company which are incorporated in BritCham have been representing in community of business internationally, especially in Indonesia for 40 years. BritCham have often organized various discussion and business forum that involving political leaders, government executive leaders, business leaders, analysts, and academic. BritCham has a mission to facilitate trade and growth in investment between Indonesia and UK. Based on BKPM, the National Investment Coordinator Agency, data in 2020, that is during 2015 until fourth semester of 2020, UK was ranked of 10 countries of largest investment in Indonesia, with total investment $2.8 billion from the 3,060 projects. It shows us how strategic the position of British investment as the part of investment improvement to increasing Indonesia economy. Ladies and gentlemen, COVID-19 pandemic, which has been happening since last year, afflict more than 200 countries with over 4.5 million inhabitants dead. It is demanding the entry government and in the world to undertake the effort in handling, decreasing the case and recovering it. Indonesia itself has implemented several strategies, include 3T, testing, tracing, and treatment, and vaccination. thus it is important to ensure the availability of the equipment and health services to fulfill the objectives. Furthermore, it becomes the government priority to recover the nationwide economy by giving capital support to enterprise, as well as the creating of programs of solid works, including infrastructure. The development thus is all work need a great support system of information and technology. In our insight, the cooperation with the private sector become a necessity to support achieving all those mentioned objectives. UK is known by the excellence in research and has good health system among the country in world. The Indonesian embassy in London did a series of assessments such as obtaining the vaccine COVID-19, both in the access purchases and supply production aspect, as well as gain a joint research in candidate vaccine which are development in UK. Minister of Investment, head of National of Investment Coordinator Agency, BKPM, also expressed the confidence of international to Indonesian on investment is still awake during a pandemic COVID-19. The Europe and UK contribute the value of investment in Indonesia. UK was in the rank of top 20 investment in 20 and 69, a total actual investment of 182.1 million US dollar and increasing as 192.8 million in 2020. Dear our colleagues in BritCham, I would like to inform you that APEKSI, as forum of all Indonesia city governments or local government, we have members of 98 cities, consist of 93 autonomous cities and 5 administrative cities. We are divided in 1 regional commissariat to facilitate communication with all members. And association, our role becomes representative and mediator throughout the Indonesia city government, provide member service such as capacity building, policy advocacy, forums to share, learn, transfer, and replicate a varied knowledge and experience, as well as disseminate the information. By the hashtag APEKSI Synergy, APEKSI is pleased to collaborate with various parties, including the private sector, in facilitating the entry city government in implementing and achievement of sustainable smart city. We realize that not all local governments have been actively building cooperation with foreign investors. We also realize that there is still many needs to strengthen and capacity, experience, and network in many needs in building this collaboration. But our spirit is very strong and high enough to build this. Therefore, through this forum, we hope that a better communication process will be built and great for starting on improvement to future mutual progress. Perhaps there are many challenges has happened in the process of developing cooperation for part, but hopefully with this forum, we will build a better understanding and agreement for new future progress. We hope by the new law and job creation, which was issued by the government last year, it will provide a better investment climate and improve the economic growth. Once again, we hope this webinar will encourage of us through the discussion process, sharing experience and knowledge, and build opportunity to cooperation between Indonesia city governments and British companies. Hopefully, the mayors of staff are able to seize the opportunity of the partnership that is potential developing sustainable achievement by 2030. Thank you, the speaker, for your time and opportunity to share. And we hope you may share your input for future cooperation opportunities to develop smart sustainable city, especially in dealing with the pandemic. Thank you very much to British Chambers of Commerce for this very good collaboration. Hopefully this will bridging and good start of collaboration between APEKSI to be a productive from forum and valuable communication with the British companies for the common achievement in the future. APEKSI is very pleased to facilitate the members to get better cooperation with British Chambers and of Commerce members. Thank you all can say. Thank you for the opportunity. Terima kasih. Wassalamualaikum warahmatullahi wabarakatuh.
Baik, terima kasih banyak Pak Marten. Thank you Pak Marten and also Olly for the kind opening notes. I really hope our collaboration going further between the BritCham and APEKSI's members will continue going forward. There's a lot of aspects that we can share knowledge together and collaborate in the future, I hope. So without further ado, we'll go into our first speaker, Professor Kevin Baird. He's an expert in the as a medical microbiologist with the Center for Tropical Medical Medicine and Global Health at the Northfield Department. And in Indonesia, he's the head of unit at the Eijkman-Oxford Clinical Research Unit within the Indonesian government's premier biotechnology laboratory, Eijkman Institute for Molecular Biology on the campus of Cipto Mangunkusumo Hospital and the University of Indonesia.
Ellen, you broke up a bit. You're muted. Shall I go now? All right.
Yes, please, Kevin, carry on.
Okay, yeah.
Terima kasih, Ellen, dan selamat sore Ibu dan Bapak sekalian. Respects to our many distinguished panelists and guests. Thanks to my friends at G4S and BritCham for inviting me to do this. I'm very happy to do it. I've been asked to give a snapshot update on the status of the COVID-19 epidemic in Indonesia. I am employed by the University of Oxford and supported by the Wellcome Trust. I'm based here in Jakarta. I have experienced this epidemic with you as neighbors. And I hope to give you a useful update, a bit technical, but I'll give you an update on the progress of the epidemic in Indonesia. I don't have to explain, the epidemic in Indonesia is part of a global pandemic of this newly emerged virus called SARS-CoV-2 that swept the world in early 2020. If you can count the waves here, you'll see we're in the 6th wave globally of this pandemic. Slight hope there that it's abating, but we don't know. Hundreds of millions of cases, several million deaths. Very, very tragic biological event. Here are the numbers for Indonesia from this very useful website. There in blue on the bottom. These numbers are only a week old. 4 million cases, 136,000 deaths. But look at the vaccination numbers. Those are really getting bigger and bigger, and that's quite an accomplishment for Indonesia. Indonesia should be proud of that progress. And I'll show you later, I think it's making a big difference. This is the map from the same website, and if you just took it at face value, you would say, well, it's almost safe to go anywhere in Indonesia, except Java and maybe Surabaya. But it's a bit of a distortion, and you should be careful trying to interpret the map literally. The big dots are a distribution both of population density, but also access to testing. Access to testing in rural areas of Indonesia is not great. So let's talk about access to testing. You can see at a glance in this national level map that Indonesia is not among the high level testing nations. And I'm making this point simply to say that the absolute number of cases that I've just shown you is very probably a fraction of the actual number of cases. I'll show you what I mean. This is from the Our World in Data from Oxford, very useful website. I encourage you to visit it. What you can see in this graphic is the COVID-19 tests per 1,000 people per day over the course of the COVID-19 pandemic. And you can see at a glance that Indonesia is quite low, along with some other Asian countries. Densely populated countries like Indonesia and India have difficulty getting great access to testing. So we have to look at the case numbers, understanding that the surveillance systems are not detecting all the cases. So just to confirm, I should say emphasize that confirmed infections will be a fraction of the actual infections. And this is a function both of that access that I've already talked about, but also unique to the biology of this infection. Most people don't get ill. And of course, almost none of them will get diagnosed. They transmit the infection, but they do not become ill and get counted as a case. But all that said, the trends in the numbers of cases is very meaningful, and it's robust and reliable. So absolute numbers, we don't put much stock in those, but the trends we put great stock in. And here's the trend for Indonesia from the COVID-19 government website. It's about a week old. Very happy news here. I mean, it's a bit bouncy, but you can see a very sharp downward trend. And we believe this with all the caveats on diagnosis and case capture. The cases and transmission are truly down and way down. Same goes for deaths. In the middle of the surge, most of you know, the hospitals were severely overwhelmed, and we saw quite a lot of tragic mortality as a consequence. The pressure is now off the hospitals, and your chances of having a good outcome in hospital are much better than they were a couple of months ago. Everyone's talking about the Delta variant. It is a very important feature of the pandemic. This is the data for Indonesia, again, from this website at Oxford. We first detected Delta way back in December of 2020, long before anybody knew anything about it or knew that it was important. And it smoldered along for months and then slowly increased. And then it dominated and drove the surge in cases that we saw starting in early June. Delta is much more infectious. We know that now. It is also much more dangerous to younger and healthier people. This is from the Government of Indonesia website. It's just a look at the statistics on the left panel is the distribution of cases and outcomes according to age group. So the bars are age groups. And you can see that the burden of mortality was overwhelmingly in people over the age of 50. Then in the bar the bars on the right panel, you can, if you look at the values of people with diabetes, hypertension, and heart disease, these are definitely risk factors for poor outcomes with the COVID infection. But actually, the people with those risk factors were only 25% of the deaths due to COVID. So this virus is perfectly capable of doing serious harm to otherwise healthy people, and we should respect it as that dangerous. So let's look at the numbers in Jakarta specifically. I like the numbers from Jakarta because the test coverage is so good. Very easy to get a test here. So the absolute numbers to me are more meaningful than the national numbers. And this drop in cases is really astonishing, almost unbelievable in terms of the impact of the relatively modest countermeasures implemented by the government. We're down, as of September 7th, we were down to 217 cases a day. You have to go back to the week before Lebaran to see value that low, and then all the way back to the early days of the pandemic to see it lower still. This is an unprecedented drop, sudden drop in COVID-19 cases in Jakarta. So were the countermeasures that effective? We don't think so. We think something else is going on here. And I think it's good news, actually. Let me share it with you. This is what's happening in Vietnam today. All through 2020 and through the first half of 2021, Vietnam had almost no cases, and they were not rolling out vaccine. So there was no natural immunity in that population or no vaccine-acquired immunity. Now, suddenly, in the middle of 2021, they get a surge. They're in the middle right now of a very aggressive Wuhan-style lockdown in Ho Chi Minh City. I mean, people can't leave their homes for weeks, and yet the surge is continuing. We think that the difference between the Vietnam surge and the Indonesia surge and how it's rapidly collapsed might be herd immunity. There's a possibility of that. It appears that when natural infection and vaccines are combined, that we get a much stronger immune response. And we think that maybe that is what's happening in Indonesia today. Well, this is my last slide. Just to sum up, the sharp drop in cases is very likely due to high vaccine coverage, especially in Jakarta, really good coverage, along with high rates of natural infections. We think that in Jakarta, even before the mid-year surge, that 50% of people who live in Jakarta had seen natural infection. So natural immunity plus a vaccine immunity may account for the current suppression of transmission. And that's what we're seeing, suppressed transmission. How long will that last? We don't know. It could be a few months. Maybe it will go a year. We just don't know enough about the biology and immunology of COVID-19 to make a reasonable prediction like that. But we're in a good spot right now, and it might last. Thank you.
Okay, Captain, thank you very much. That's a very good news for all of us. It's good to hear that we are on the direction of herd immunity, something we all hope for, and lockdown may ease. Okay, the next I will give the floor to Basil, who's the regional head of security and risk management and business intelligence at Hill Associates. He'll introduce like the technology that's been implemented by Hill Associates and help and helping with the COVID tracing, and see what we can learn from it. Basil, the floor is yours.
Yeah, thank you very much indeed. Just stop to share my screen. Okay, somebody tell me they can see that. Can you see that?
Yeah, all good.
Okay, good. Thank you very much for the opportunity to speak this afternoon. I'd like to talk about contact tracing and the response to COVID-19 pandemic. I'd like to share my thoughts and also ask some questions about the current process of contact tracing. Now, way back in the 11th of March last year, the World Health Organization labeled COVID-19 as a pandemic. But 18 months later, very few countries have an effective contact tracing solution. Most countries have struggled to establish this most basic public health procedure. So why is contact tracing failing so dramatically? The reasons are complex and systematic. In many cases, antiquated technology, underfunded healthcare systems, and more importantly, the mobilization and management of contact tracers for a country-level contact tracing program requires an army of people. We're also facing challenges by cautious populations and their distrust of personal data, health authorities, and new technologies. There have been many examples in the media recently of government-level data breaches. That's just one area that raises people's concern. Now, there are some success stories linked to contact tracing: South Korea, Vietnam, Japan, Taiwan, and of course, Singapore. However, how many other countries have such obedient populations? That's the common denominator with those successful countries. In fact, in some countries, there are active demonstrations against tracking and tracing and using applications. Now, in theory, contact tracing is a very simple process. The 4 stages you see on the screen in front of you follow most accepted process. We identify the positive case, and then we contact that person and we interrogate them through interview or technology if they're using that, and we identify all those people they've come into contact with. And then we advise those people they should quarantine, or we give them other information to follow. And that should break the chain of transmission. So that should be effective. So in theory, a very simple process. However, the reality is very, very different. There are failures at every stage. Those who run contact tracing process are facing a bow wave. And here's just a few of the problems they face. People sometimes get COVID and don't know it. They don't show any signs or symptoms. People who do feel oid sometimes choose to avoid or delay getting tested. Positive results can also take days to confirm. Not everyone who tests positive isolates when requested to do so. That compliant population that we mentioned at the start. People cannot always be reached for an interview, and some people don't provide details of their close contacts. Not all contacts are willing to comply with quarantine order. Again, that compliance. And this is linked to the size of the populations in many cases, and contact tracing is managing at a country level. Now, the World Health Organization's benchmark for successful COVID-19 contact tracing is to trace and quarantine 80% of close contacts within 3 days of a case being confirmed. A goal that few countries achieve 18 months after the start of the pandemic. Of course, there is technology there to help and assist with these systems. Something which would be very familiar to all of us, track and trace apps, and some of these have been successful. However, they do have limitations. Many require regular user data input. We require that user compliance again. Many governments have been very quick to post on media that tens of millions of their populations have downloaded their track and trace app. but there's a very big difference between downloading the app and being a compliant user. There's also an assumption everybody has a smartphone or some sort of device that is powerful enough to run these apps. And finally, the most obvious flaw, the smartphone battery life. It needs to be there running to support all the platforms that are running from it. So therefore, track and trace apps is a high probability of human error. So I'd like to ask this question: is it now time to rethink the contact tracing effort? Many of the problems that I've raised here are related to contact tracing and the related size of the populations in country level contact tracing schemes. Could an alternative be to look at workplace communities? That would give us a manageable population. It would also give us a likely compliant population, because people will be compliant because they'd link it to the security of their jobs. And in many cases, workplace communities reflect the local community. So would we be capturing more effective and more accurate detail this way than a countrywide contract tracing scheme with all the flaws I've already mentioned? And finally, data protection, very important to all of us now. And again, likely that those people in the workplace communities will be more compliant and happy to share their data because they know that their workplace and the people they work for already have their personal data. Additional benefits of moving contact tracing to the workplace and away from a countrywide scheme. Now, many organizations already have an effective health and safety process in place where staff and visitors are subjected to screening and controls before they can move onto the work site and workplace. And once they're in the work site and workplace environment, they have to follow rigid protocols and regulations to mitigate the COVID risk and that risk of transmission. But the risk is actually beyond the workplace, and it's where the people within those organizations have no control over their staff or their visitor behaviors. So maybe this is a good match where we move it to the workplace, the contact tracing, and then it will give the owners of the workplace the tools they need to identify positive cases, more importantly, to mitigate the cluster outbreaks and then the real risk of the facility closure, which is not good for everybody. It could impact jobs further, the losses of jobs, and the effectiveness and continuation of the business. So what we need to do is find a solution that gives us that data protection, minimal user data input, a long battery life, and no requirement for smartphones. Now, there is a solution out there called Blue Pass, and it's based on a token. And the very small token that you can wear around your neck, it's compact and lightweight, water and drop proof, maintenance free, and it does not require a smartphone. It has a long battery life, an internal battery life that lasts up to 12 months, and it works and operates on low power Bluetooth signals. Data protection is covered because the whole system can run on a simple staff number or an alphanumeric number that's linked to the individual token. The activation process for this track and trace contact solution is equally as simple. We would come to your site or facility and we would register one of these tokens to each one of your staff. It then becomes their personal token. All they need to do then is to remember to bring it to the workplace location. There is no further user input, data input required. So what happens then from that point? A very simple three-step process. Once a positive case is identified, we would retrieve the token, interrogate the data on that token, which is data that's captured from all the other tokens because they speak to each other constantly. And that will give us the information we need to print off a data sheet, a report, and there you would have all the people who've been exposed to the positive case, and you can take an informed decision about what to do with those people, therefore mitigating the real risk of a cluster outbreak and possibly site closure, as I've mentioned before. Now, this technology has been developed in the highly regulated Singapore. It's a user-friendly solution for every work environment, and it does not require a smartphone or a power source, as I've said. So it takes away that human failure element. All the user needs to do is remember to bring it to the workplace. It requires no data input after that activation process, and it will give the workplace environment ownership of their own track and trace data. Data protection holds no personal data, so we cover that risk and that concern from the population. Now, Blue Pass is the marketing name, but as you can see, there are different colors, and you can use those to match zones and staffing groups to give you more control and compliance in the workplace. Now, looking further ahead, contact tracing use over the horizon. Now, Professor Kevin mentioned the Delta variant. We're all aware most dangerous due to its transmissibility. However, the World Health Organization is declaring more variants of interest all the time. Now, one of the variants of interest that's propped up recently is the MU variant, and reports suggest that this variant could evade the resistance created by vaccination or infection. We will need more effective contact tracing to deal with such variants. Blue Pass could be that solution. And finally, contact tracing in the workplace can also support effective safety and security programs. When the staff and visitors are wearing coloured tokens, just like your ID card, management and security will be able to see at a glance that these people are in the areas where they should be, and more importantly, identify them when they're in areas where they should not be. Thank you. That completes my presentation within the allotted time.
Hello, thank you, Basil. That's very interesting information that you shared. Very good alternative to what we have as well today, and definitely a lot more detail in our keeping our the contact that that's been through. Okay, next we have a representative from the Tangerang city, and unfortunately, Pak Arief, who is the mayor of Tangerang City, sent his apology. He cannot join. His expert staff, Pak Ruta Irang, have already joined this webinar, and we look forward to hear what Tangerang City experience and innovation that's been in place. I think there's a lot of members here who are from mayor. I see the mayor of Balikpapan, Pasaruan, and also joining here in Padang. So a lot of people are very keen to learn from Tangerang City. Okay, Pak Ruta, silakan.
Okay, thank you. Good afternoon, ladies and gentlemen. Let me talk about our city experience dealing with or handling the pandemic within these 2 years, the last 2 years, and I'm talking on behalf of the mayor. And about 1 hour ago, he asked me to represent him to talk about this. Let me share the slides. Here, I want to talk about the pandemic and economic recovery of Tangerang City. For the first slide, we try to inform the general situation of COVID in Tangerang City. Started from about the March, in the beginning of March in this year. In this graph, we can see that this one, the graph is inform about the confirmed of active, the active one, and this graph from the March until today, until not today but 2 days ago, until September of 10th. This is the confirm of death, and the red one is the confirm of positive of the COVID-19. It means from this graph, we want to share the information that we have decreased the number of confirmed active from about from the beginning of July. It's about 6 or 7,000 people, and this day we have reached 2 days ago about 200 people in our city. And nowadays in Delhi, the confirmed active people that get the COVID up and down about 20 people per day. And coming to the general situation of the bed occupancy ratio of the hospital, from the beginning of July that we have very peak number of affected people at on last July. It's about the bed occupancy ratio about 90%. And this day, 2 days ago, we got report from the hospital, from all of the hospital in the Tangerang city, about 7.5%, where the number of bed is in this city is about 1,207 beds, and we have the ICU about 87 beds, and this is the ratio of this day. And the graph below, from the July until these days, this is the number of the house for isolation. The Tangerang city, we build or we provide some place or house to isolated person. And nowadays the people who occupy the isolation house is getting smaller and smaller. And coming to the next slide, this is the number of accumulation of vaccination in Tangerang city. This graph starts from the beginning of March and exactly at the 12th of March 2021, and until 2 days ago, about 11 September. And in total, the first dose of vaccination is about 900,000, and the second dose 500,000. And this numbers is for the people of Tangerang, that in general the population of Tangerang is about 2 million people. So it means it's about 50% of the population we have get the first dose, and for the second dose it's about 40 or 25% of the population, the second. And the third dose, especially for the people who working in for the not public, for the health service, we give them the third dose, and the accumulation is about 10,000 people. And what we have done about to handling the pandemic, that we also occupied the application from the National Health Department, Silacak application. Of course, we have synchronized the data from our city to the national database. And also for the local application, we also use the Sirona application here. Sirona application is used for puskesmas and hospital inside the Tangerang city. In this application, we used to report the daily cases of COVID-19. It means in this report, we also put the number of phone and also the number of the family in their house, so we can tracing them in their neighborhood. And also we can cure and we can care their family that not injured with the COVID-19 based on this database from the application. And next, the next slide, we also prepared the application of Sigacor. Sigacor is as we know, all of we know that our government proposed to handling this pandemic by utilize the neighborhood, and also we working together with the head of the neighborhood in the very the lowest level of the governmental organization, that is head of neighborhood, and this head of neighborhood was asked by us, the government, the Tangerang city, to monitor what happened in their neighborhood and put the data to our application, to this system by Sigacor application, so we can get the real data from the field, because in our society, not all of the people wants to examines their condition when they get maybe get exposed by the virus, or they have some symptom, but they not willing to go to the hospital or to the public health center. So we believe to the head of the neighborhood to care about them and care to their neighborhood in the field. And this is the other application. SIDATA is the application built by Tangerang City to collect data in one information system. In the beginning, this system was used to record social assistance recipients, and this day it's we enrich to identify the infrastructure damage and the others, including the how we prepare the data to give some economical support to the society by this data. It means this is application to data retrieval by name by address. And this slide show the one of the economic recovery program that we do in our government. In this 2021, we also give some beneficiary to the people about 700,000 rupiah to the 20,000 people. It means we give the money to the market, to the society, about 15.2 billion rupiah. And this program also conducted from 2020. And that's what we have done to facing and handling the pandemic in Tangerang City. Thank you for your attention.
Hey, terima kasih Pak Ruta.
Yeah.
That is very interesting to hear what Tangerang City has been doing. Like, didn't realize I saw this up, and it's very impressive bridge all the way to the neighborhood level. That's something where we learned today. So unfortunately, Dr. Neville not be able to join today, so we can move to a Q&A section at the moment. First of all, there's I noticed a few mayors who's actually attending this meeting at this webinar today. If any of the mayor would like to share their experience in their cities as well in the handling of the pandemic, I'm very welcome to open the floor. Okay. Yeah, if there's any of the mayor would like to do sharing, can just raise the hand and drop a message in the Q&A. I'll call you out. So in this case, we can move to some of the question here. And first question, I think this is like something that is very relevant to be answered by Professor Kevin. So the Indonesia government is planning to change the status from pandemic to become endemic. Do you think what do you think of the status of this change, and also to Pak Ruta, if there is any local government plan that's been prepared to face this status change from pandemic to endemic?
Shall I begin?
Yes.
Yeah, I think the transition from pandemic to endemic is a bit subtle. And I think it's misunderstood. I think some people believe that endemic means that everybody's immune. There's not much morbidity and mortality, but actually that's not true. If we look at other endemic diseases like malaria, tuberculosis, dengue fever, these are endemic diseases, and they do cause very significant clinical and public health problems. And the idea that SARS-CoV-2 infection will transition to an endemic presence, which means always present at some level, it can rise, it can fall. Yeah, I think that's an accurate forecast. I think we are going to be looking at endemic COVID-19 for many years to come.
See, the years to come, any chances to say we can change in the coming years? Do you think that, like, because looking at the graph that you're sharing at the moment at the backdrop at possibly we already herd immunity, are we already at the stage where do you think that this spread might be more like something that is more like an endemic than a pandemic?
Well, I think we will have much better tools in just a few years. I think we'll have much better diagnostics, we'll have better therapies, and we'll have better vaccines. And even though it's endemic, the harm that it's causing is going to be greatly mitigated, right? We don't stay in our homes because there's endemic tuberculosis in Indonesia and many other countries, because we have the tools that can mitigate the harm. It's hard to put those tools out to the most remote and isolated communities. It's difficult. Indonesia struggles to do that. Many countries struggle to do that. But the idea that we are going to magically eradicate SARS-CoV-2, we shouldn't be thinking that way. We should be thinking of this virus as an endemic presence for which we will have tools that greatly mitigate the harm done.
Okay, that's a very positive note. Ruta, do you have views about like what's the city government, local government is like preparing in terms of the strategy and the transition when we are coming out of this? I think that's also covering some of the question as well, that like asking if what happened after the patient, after like the hospital. So yeah, post-pandemic.
Yeah, thank you for the question. From the last July that we maybe based on our data, the we call pandemic in Tangerang because it happened all of the globe. But we said that the affected people it's very high in July, and based on our data, this is the third wave maybe because the peak started from maybe last September last year, and then the second peak happened maybe about February and getting down, and the third the highest peak it's about last July, and nowadays it's getting decreased. And nowadays at the last July based on national ministry, Tangerang localized as the maybe level 4 as the very high risk zone of Tangerang. And this day, last week, the national government report that Tangerang City already getting to the second zone, the level 2. So it means it's getting safer as before. And about due to this situation, also of course we changed the policy to the society to the society for the doing activity, especially for the economic activity. For example, nowadays we we allow the restaurant opens with some certainly of course with some restriction, but still with restriction. And from today, this week, we start to evaluate to open the school. And of course, for the economic stimulation, we start to give some programs to the neighborhood, to the society, that society can get the benefit about, let's say, project, or let's say we push the society to give some promotion so that the economic activity try to can start to move on. And about the program for this last 3 months of this year, of course we try to stimulate the lower level economic for the society. And we also plan for the next year, maybe for the bigger project about the, let's say, about the how to say, pariwisata, yeah, about
Tourism, yeah.
Tourism, yeah, because we want to, because Tangerang City we have Soekarno-Hatta International Airport, and we have a lot of hotels here, and we try to please prepare the hotels and the maybe the culinary spots to prepare for the these last 3 months of this year and for the next years. Maybe that what we have done.
Thank you, Pak Rutte, for the sharing. I think we only just have time for one last sharing. Over here, we have the Mayor of Padang, Pak Henry Septa. Yeah? I think we'll welcome you to share some of your experience as well. And it's very interesting to hear from Tangerang, all this innovation. And so, yeah, we're keen to hear what Padang is doing, has been doing as well.
Okay, good afternoon, ladies and gentlemen, and also for the speaker. I'm not a mayor of Padang City actually, but on behalf of Mayor of Padang City, because now he has other agenda. Okay, my name is Arief, Head of Cooperation Division of Padang City. Beside me is Mr. Andre, head of Trade Department of Padang City. Actually, I would like to give some question. My question goes to Professor Kevin. I think it's a very interesting question, presentation, since you are presenting with the data. My question is to Professor Kevin. So many vaccine are available in Indonesia from another countries. So my question is, which one vaccine actually is most appropriate for the Indonesian community? Because compared to European, America, and other Asian countries, climates in Indonesia is quite different, even we compared to the European countries. So my question is, which one the vaccine actually is more or most appropriate for the Indonesian community? And the second one is, it's very interesting on your slides about the composition of the virus since Delta threats Indonesia. So nowadays, most of diseases or infection is due to Delta variant Delta. So my question is, what about the previous variant, COVID-19 itself? Are there already eliminated, and there is no other variant except Delta variant? That's my second question. Thank you very much.
Thank you.
Okay, thank you for some very good questions. Some difficult to answer questions. The question of which vaccine is a very complex one, and I think the most important, there's many factors to consider, and one of the most important is access to the product. I think any vaccine that can be manufactured locally is a good option. And if I'm not mistaken, the Sinopharm vaccine is being made by Biopharma. So that improves access, and beating this pandemic is all about access to vaccines. Access is number one. There's, as you mentioned, a half dozen very good vaccines out there. The best one for any country or city or province is the one that you have the greatest access to, because they're all good, every single one of them. Some might be better in terms of cost, others might be better in terms of lower side effects. Some might have longer lasting immunity than others. We don't know that yet. But to answer your question, I think the Sinopharm vaccine that we have the greatest access here, there's good evidence that it prevents serious illness and death. We're getting evidence that a booster with another vaccine might even provide greater protection. So there's no certain answer to your question, except to say the vaccine you can get access to most easily is the best vaccine for you. Your second question was about the landscape of variants out there. And the original COVID-19, SARS-CoV-2, the one that came out of Wuhan, we call that variant Alpha. And as soon as Delta appeared, the Alpha variant tended to vanish. It was outcompeted. It could not compete against its Delta brother or sister. And it has mostly vanished. And now we're looking in Indonesia and many other places at a population of viruses that is nearly 100% Delta. That is going to change, we believe. There's new variants coming up all the time. There's very good genomic surveillance going on in Indonesia now. Several hundred whole virus genomes are being sequenced by the Eijkman Institute, Litbangkes, and the new startup called Genomic Solidaritas Indonesia. These organizations are doing a great job doing the genomic surveillance that we need right here in Indonesia in real time. But for the time being, Delta is the only variant we really need to worry about, but we do need to worry and watch for a new variant. I hope that answers your question. Thank you for it.
Thank you very much, Professor Kevin.
Okay, thank you. I think that's it for our talking today. Actually, so yeah, it's been really great to have all the members here, and also to get all the members of APEKSI joining this call. It's really great to start this collaboration and partnership. I hope that I can collaborate more going into the future. And there's a lot of issues in the cities we can definitely further discuss. And the sharing of information, learning from best experience, like just what Ruth is sharing with us, that's really incredible to know. It's all this up and information that's actually available and being collected. So they're always keen to know more. And thank you very much for Professor Kevin Baird and Basil. Neville's actually now in here, but unfortunately, due to time, not be able to hear his sharing at this moment, hopefully next time. And yeah, thank you very much for joining. And also I'd like to mention thank you again for our sponsor, G4S, Jakarta Land, and from Bicycle. All right, bye.